My name is Jonathan Perlstein. I lead enterprise marketing here at Virta Health, and excited to have everyone join us today to discuss diabetes reversal benefits beyond metabolic health. And I have to say, I am personally super excited about this topic. It really gets to the heart of why I joined Virta and why I find our work here so meaningful. Through my time at Virta, I've gotten to know a lot of our patients, and you'll hear from one in a few minutes, Andy Riddle. But many of our patients have successfully reversed their type 2 diabetes. Many are working towards it. And along the way, as I've been here at Virta, I've heard that the experience of living with type 2 can feel, from a patient perspective, can sometimes feel all-encompassing. From a quality of life perspective, type 2 diabetes can affect nearly everything and anything: your kidneys, your heart, blood pressure, eyes, liver, feet, fingers, mental health. I had one patient describe it to me like it's like having the rear axle of your car out of alignment. Nothing seems quite right. So when we talk to patients about why diabetes reversal is important to them, what it means, we get a lot of responses. We often hear, of course, about the excitement around eliminating drugs, of getting off of insulin, of bringing blood sugar under control. But we also hear increasingly more about these quote unquote other benefits. And all those other benefits, the other benefits, are something that we want to dive in today. And that's going to be the focus of today's webinar. So over the course of this next hour, we're going to do three things. So first, we're going to talk to Andy, a Virta patient, to discuss his experience living with type 2 diabetes, as well as reversing his type 2 diabetes, to better understand some of these downstream impacts of diabetes reversal. Next, we'll hear from Amy Mckenzie, who will provide a clinical overview of some of the research on diabetes reversal's impact on whole person health. And then finally, we'll hear from Kevin Eichorn, the Chief Medical Officer of Dean Health, and we'll hear about his experience with diabetes reversal for his members, as well as his advice for other health plans and benefits leaders. So to kick us off, I'm going to turn it over to Andy in a minute, but first I want to introduce him. Andy has been a patient at Virta for 6 months. He's 56 years old and a former restaurant manager. He's also a classically trained chef who still enjoys cooking for his family. And he's currently working on 2 novels about North Florida, where he resides today. Andy, we are honored to have you here today and share your story. Over to you.
Well, thank you. It's a pleasure to be here. I was given a couple of different ideas on what to work with and what to talk about. So I figured I'd just give you a kind of a timeline of my experience. I was a 50-year-old guy who thought he was indestructible and learned very quickly that, like a meme on the internet says, when you hit 50, the check engine light comes on pretty quick. And I had a couple of major medical issues, got a type 2 diagnosis, got a high blood pressure diagnosis, developed a heart condition, and a couple other things, and was trying to figure out my new life in that vein and trying to get used to all the changes. And I want to thank Blue Cross and Blue Shield of North Carolina, my provider, who recommended Virta to me. And this has been a really a godsend and a life-changing experience for me. I was able to get some guidance into things that I should and shouldn't eat and different practices, and it's been a phenomenal experience. And my coach is fantastic. And Laura is always there, always prepared with a kind word and motivation, but also has been a font of information. We're trading recipes back and forth. She's asking me questions that challenged the culinary mind, which is good. And all of these things have helped. And, the whole Virta program has been wonderful. I've had ups and downs, as you'd expect, but I've also had some major changes that have occurred because of the Virta program. I've lost about 20 pounds, which is a huge thing. I hadn't been able to lose any weight beforehand. My diabetes numbers are significantly improved. I'm showing about a 70-point drop in the numbers. My blood pressure has become significantly improved. But there are a couple that are really big for me. I was an athlete in high school and college and wasn't very good to my body. So consequently that, and then standing for 12 and 14 hours when managing a restaurant, from the waist down, I was in pain pretty much constantly. Since I've been on the Virta program, the inflammation and the pain has gone to almost zero, which is huge. I have also, the less inflammation on other parts of my body. I mean, I've got a bad back that doesn't really hurt anymore. And the changes that I've made in my lifestyle have been through Virta. It hasn't been anything else really that's been changing. I've seen a great deal of improvement in my quality of life, in the way I feel, the way I sleep. I sleep better now. I'm not taking over-the-counter pain meds every day like I was. So consequently, my stomach's better, my digestion's better, and all of this together leads to a huge, huge improvement in outlook and in mental health. When you feel better, you're going to feel better psychologically when you feel better physically. And if you feel worse physically, it definitely takes a toll on your psychology. And I've found that my outlook is better. I've found that I'm able to be more active. I'm able to spend more time writing. I'm finding my creativity is getting better. I think that's due to some, not being focused on some things that I shouldn't have been focused on. And, the whole program has been a really phenomenal improvement in how I feel and how my life goes.
All right, Andy. Well, thank you for sharing your story with us. Super inspiring. Also appreciate that you have introduced yet another car-related metaphor with the check engine light. I think that complements the axle out of alignment one that we had from earlier. And I think it is just really inspiring and a reminder of why we're all here today. I mean, we're going to dive into some of the data and the outcomes and the population level analyses, which I think are super important. But at the end of the day, it all comes down to each individual patient journey and the lives that are affected. And so I really appreciate you sharing your story with the group.
Thank you.
All right. Well, up next, we have Dr. Amy Mckenzie, who is Virta's Senior Director of Research and Innovation. Dr. Mckenzie completed her PhD at the University of Connecticut's Exercise Physiology program. And today she's responsible for the future research strategy at Virta Health. Amy, I will hand it over to you to share more about our latest findings about the benefits of diabetes reversal that go beyond metabolic health. Over to you.
Awesome. Thanks for the intro, Jonathan. It's really tough to follow Andy's story, but I will certainly try. He's certainly one of the many patients who have experienced these positive effects. So today I want to share a little bit about how that's possible with Virta's treatment and the research that we've done that highlights those effects. So you heard from Andy that diabetes wasn't the only thing on his mind. He was living with excess weight and high blood pressure and a heart condition. He talked about having pain in his legs and his back that he just couldn't ignore, and that really impacted him every day. And unfortunately, he's not alone. Nearly everyone with type 2 diabetes, in fact, 98%, live with at least one other condition. 89% live with at least two, and the list goes on and on from there. But reversing type 2 diabetes with Virta's treatment can certainly have cascading impacts on a person's overall health. Type 2 diabetes itself is a condition of insulin resistance that results in high blood sugar. So what that means is that it's insulin's job to keep blood sugar in the body in a normal range, but sometimes the body can become resistant to that insulin, so it doesn't work as well. And that causes the blood sugar to go up and to stay up over a longer period of time. And that's when we say a person develops type 2 diabetes. And this insulin resistance is also commonly happening alongside inflammation and excess weight, and many of these things are very closely linked together. So Virta's treatment targets this underlying issue of insulin resistance, and it improves the body's sensitivity or ability to react to insulin. It lowers glucose, lowers inflammation that can get in the way of the body functioning optimally, and it enables weight loss. These factors of insulin resistance and inflammation and high blood sugar and excess fat, these are all also very closely associated with many other chronic conditions. So when we improve these things and when we reverse type 2 diabetes, these effects also extend to improvements in markers of cardiovascular disease like blood pressure and triglycerides. It extends to improvements in markers of liver disease, and it even extends to things that you might not expect, like better sleep, less joint pain, and fewer depressive symptoms. So how do we do that exactly? Our treatment focuses on reversing type 2 diabetes through nutrition therapy that's focused on consuming very few carbohydrates in the diet, which the American Diabetes Association says has the most evidence for improving blood sugar and reducing the need for medication. All of this is enabled by our continuous remote care platform. This platform and our care model provides patients with access to educational resources. It connects them to their care team so that they can get nutritional guidance and behavior change coaching. It connects them with their peers for social support. It also allows safe prescription of medication by our medical staff as someone's blood glucose improves. So all of these components work together to really enable lasting health improvements. Right. So the result of this treatment is first and foremost improved blood sugar, diabetes reversal, and it allows our medical staff to safely deprescribe diabetes medications that are no longer needed. So how we measure blood sugar and how we diagnose type 2 diabetes is through a blood test for hemoglobin A1C. When this test comes back as 6.5 or higher, we say a person has diabetes. And in the clinical trial that we did, 60% of the patients that we treated for 1 year reversed type 2 diabetes to our target, which is to the point of an A1C below the diagnostic threshold for type 2, below that 6.5 level, and that they've done so without any diabetes medication or with only metformin. So you see this represented here, the 60% in the dark green and the middle green on the bottom row in the graph. So in our trial, we didn't actively discontinue metformin in our patients because there are standard of care recommendations that say it's useful in prediabetes and some other conditions. And despite that, we still had a quarter of people that achieved drug-free remission. So this means that they had an A1C below 6.5 and they weren't taking any medication for at least 3 months. So lower blood sugar is better because it means less risk of complications like kidney disease or eye disease or risk of an amputation. In this case, it also was achieved with less need for medications. In fact, in this group, 59% fewer diabetes medications were prescribed after 1 year, and that results in direct cost savings. So for insulin, one of the most costly drugs in terms of dollars and also in terms of burden that patients feel, 40% of the people on insulin no longer needed it. And for those who did, they reduced their dose by half. So when the focus is on diabetes reversal, what we've found is that you really only need one solution to benefit the whole person and their overall health. So Virta's treatment has shown positive impact not only on diabetes, but also on obesity, cardiovascular risk factors like blood pressure and lipids and inflammation, on markers of liver disease, and even some of the other conditions like musculoskeletal issues like knee pain and function, sleep, and depression. All right, so I'm going to walk through a few of these different conditions and talk about them. So let's look at the first one, obesity in the United States. It's on the rise and it certainly isn't showing any sign of stopping. Researchers are predicting that almost 50% of the adult population in the US will be living with obesity in just a few years. And obesity and type 2 diabetes are tightly linked. Those with obesity are 3 times more likely to develop type 2, and 90% of people with type 2 diabetes also live with obesity or pre-obesity. We focus on improving blood sugar and diabetes first and foremost as we reverse type 2, yet most Virta patients also experience significant weight loss. When we ask physicians or the FDA about what do they consider to be clinically meaningful weight loss, we generally say 5% weight loss is the threshold for what constitutes a clinically meaningful change in weight. 80% of the patients that we treated for 1 year achieved this benchmark. Over half lost 10%, which has significant positive implications for liver disease, which we'll talk about in a bit. More than a third of patients lost more than 15% of their body weight. Much like obesity, it's nearly impossible to separate cardiovascular disease from diabetes. In fact, there's a statement from the American Heart Association that says one might even consider diabetes to be a cardiovascular disease. Cardiovascular disease is the leading cause of death among people with type 2, and it's often called a silent killer because it can sometimes have no symptoms until a major event occurs. And to prevent these events from happening, the American Heart Association's advice is to improve diabetes and other cardiovascular risk factors. And they even go as far as to point out that carb-restricted nutrition therapy like Virta uses is effective in improving diabetes, weight, and triglycerides, which is another risk factor for cardiovascular disease. So we can measure some things in the blood and some things about a person, and we can estimate someone's risk of a cardiovascular event in the next 10 years based on factors like total cholesterol and HDL cholesterol, blood pressure, diabetes status. So we did this in our clinical trial, and we found that this risk score improves 12% relative to baseline after 1 year of our treatment. So people living with type 2 diabetes often live with other cardiovascular related chronic conditions like atherogenic dyslipidemia, which means high triglycerides and low HDL, elevated blood pressure and inflammation. And many of them, if not most, are able to resolve or normalize these conditions that are also risk factors for cardiovascular disease. Next, we'll talk about non-alcoholic fatty liver disease, or NAFLD, as we often say for short. This is also has been referred to as a silent epidemic because it's the most prevalent liver disease in human history and largely goes unnoticed. It affects about 70% of people with type 2 diabetes. And the danger of it going unnoticed is that this buildup of fat in the liver causes problems like atherogenic dyslipidemia that we just talked about. It can cause inflammation and damage, which we then call NASH. And when that happens, it makes it even harder for the liver to function normally. So the body goes in and tries to repair the damaged cells, and that ends up leaving a scar that we call fibrosis. And that's essentially tissue that's not doing the job that it's supposed to do, and that can ultimately lead to liver failure. But we also found that this too improves when you reverse type 2 diabetes with Virta's treatment. Rather than doing an invasive liver biopsy to get whether somebody has fatty liver or fibrosis that needs a surgical procedure, you can also calculate a score from some markers in the blood that tell you if it's likely that a patient has fatty liver or fibrosis, that's scarring. So 30% of people with fatty liver, according to this score, were able to normalize their score after 1 year. And for those that were suspected to have progressed to fibrosis based on the score, 40% were able to reverse that as well. Moving on to the knee. So unlike the silent effects of liver disease, people with type 2 diabetes also live with musculoskeletal pain, and they feel it daily. You heard Andy talk about how much pain he felt in his legs, and he just couldn't ignore it. One common example in diabetes is osteoarthritis at the knee that causes pain and interrupts life every day as people walk from the car to the office building, upstairs, through the grocery store. They have pain when they kneel down to the floor to be able to play with their kids or their grandkids. And in some cases, so much so that the pain is not only physical, it becomes emotional because they can no longer do the things that they want to do or need to do. People with diabetes are disproportionately affected by osteoarthritis at twice the rate of the general population. So for Virta patients in our clinical trial with knee pain, when they enrolled in the trial with us, they report that their knee pain is lower and their function is improved after 2 years. And that's quite the Virta data is shown in the blue bar, the dark blue bars where it's getting better. And that's quite the contrast to the usual care group in the trial in the light blue bars who are showing that they mostly worsened. Sleep is another area that's particularly troublesome for many people with type 2 diabetes. Type 2 and its associated chronic conditions can be painful, they can be stressful, they can be uncomfortable, and that makes it difficult for people to get good quality sleep. Sleep disturbances or poor quality sleep, on the other hand, can negatively impact glucose levels, insulin resistance. So people with type 2 diabetes find themselves in this never-ending cycle of bad diabetes and bad sleep. So we measured patient-reported sleep quality in the clinical trial with a validated tool called the Pittsburgh Sleep Quality Index. From this, we found that poor sleep was common among the participants, with 2/3 being classified as poor sleepers at the start of the study. But over 1 year, nearly 1 in 5 people who were poor sleepers at enrollment improved. So we were able to reduce the prevalence of poor sleep within the group by about 12%. Much like sleep disturbances share kind of a complex and complicated relationship with type 2 diabetes, depression does too. People with type 2 diabetes are 2 to 3 times more likely to have depression, and less than half are actually diagnosed and actually treated. The diagnosis of type 2 diabetes can be very stressful. It can be an emotional moment for people when they find out. And then it can become even more emotional and stressful as they begin to live with it. They experience burdens of needing to rely on medications like insulin. They deal with painful injections. They deal with the burden of keeping it cold, the burden of having enough money to keep it on hand and in the fridge, the burden of needing to carefully regulate their blood sugar going too high or too low, and then needing to rest and recover from those episodes when they happen. And these burdens can really add up. And it may be one reason why 1/3 of people on insulin experience moderate to severe depressive symptoms. So you can see that this creates yet another vicious cycle for people with type 2 diabetes, because depression symptoms are associated with worse self-management. Things like missing doctor's appointments, not being particularly adherent to taking medications, and ultimately having worse blood sugar. One of our patients, Cheryl, shared her perspective with us, and she said, "I believe I was suicidal, not in the way that I would get a gun and go kill myself, but I knew that if I didn't take care of myself, the diabetes would kill me, and I was letting it kill me." And I think that listening to Cheryl's perspective really kind of highlighted for me the complexity of the interrelationship between type 2 diabetes and depression. So for patients treated at Virta, many experience rapid, significant, and sustained improvements to mental health. After 2 years of Virta's treatment, nearly 1/3 of the patients no longer met the clinical definition for depression. And we often hear that people with depression tend to have worse glycemic outcomes, higher body weight. So we looked at patients who had a history of depression, and we saw that they had similar improvements in A1C and weight as well. So what this means is that the Virta treatment can also work for people who have depression. So I know that I've gone through a lot of different chronic conditions that commonly occur with type 2 diabetes, so I want to pull it all together. We've talked about obesity, cardiovascular disease, liver disease, poor sleep, knee pain, and depression. And you can see that type 2 diabetes is about much, much more than just type 2 diabetes. So in the dark blue bars on this graph, you see the people with type 2 diabetes treated at Virta lived with all of these other conditions. Half had atherogenic dyslipidemia, a cardiovascular condition. 3/4 had high blood pressure and inflammation. Nearly all were suspected to have fatty liver. 1 in 4 already likely to have progressed to fibrosis of the liver. 2/3 with poor sleep, and some had depression and knee pain. And when you manage type 2 diabetes medications, these other conditions are left mostly untouched. You need a different treatment for almost every single one of them. But when you reverse type 2 diabetes, particularly with Virta's treatment, you treat the common underlying factors, and you get broad benefit to overall health and for the whole person. So I've shown you a lot of the data and the numbers, but what's most important are the people behind those numbers. So I want to share a little bit with you about what our patients have to say about the impact that Virta's had on their health and in giving them their life back. One said, with the support of Virta, I've completely changed the trajectory of my mental and physical health. On Virta, another said, on Virta, I feel like I can now do anything I want and I'm in control of my life and health. And another said, if I hadn't started Virta, my life could be anywhere from sitting on the couch to buried in the ground. Now I get to spend time with my grandkids. I know I'm going to survive a lot longer because of Virta. So I hope that I've been able to give you a little bit of a sense of the impact diabetes reversal can have far beyond type 2 diabetes at both the individual level and the population level. So thank you for letting me share all of that, and I'll turn it back over to Jonathan.
Wonderful. Thank you, Amy. And Amy, I really want to commend you both for your presentation of the research today, as well as all of your work in behind the scenes over the last 6+ years in making this research happen. I feel very immense gratitude to work at Virta and just know that all the work that we do is really grounded in the best research and science. And we are really unique in the market, both in terms of the breadth, the depth, and the duration of our clinical trial and clinical research into outcomes around type 2 diabetes reversal. And a lot of that is thanks to Amy and I know many other people as well in your team and the work that you've done over the last several years. So thank you so much. That was a super helpful discussion. And we're going to switch gears to our next guest here in a moment, Dr. Kevin Eichorn, and kind of shifting gears from clinical research to more quote unquote real world analysis of Virta as it is implemented in a commercial health plan setting. And by the way, we have a lot of these kind of quote unquote real world data points. At this point, Virta is working with over 30 large health plans across the United States, over 300 large employers. So our data on the outcomes and the impact of diabetes reversal is continuing to grow, and we'll have more research, I'm sure, over the next several months. So let me introduce Dr. Kevin Eichorn, who is the Chief Medical Officer at Dean Health Plan. Dean Health Plan was founded in Madison, Wisconsin, and is now partnered with Minnetonka, Minnesota-based Medica Health Plan. As a provider-sponsored community-based health plan, Dean Health Plan serves over 500,000 members in a range of insurance products in 4 states. Dr. Eichorn joined Dean Health Plan in 2016 and has been overseeing quality performance, health outcomes, affordability, and member experience. Kevin, we are so excited to have you. Over to you.
All right, very good. And I'd like to thank the Virta team for asking me to participate. And now I'd like to start by saying, there are certainly Virta partners on the employer, payer, and health system side who have, longer and larger partnerships with Virta. But I was hoping to, speak to the attendees on this call about some of the considerations we had when we were considering Virta and some of the considerations we had as we evaluated how we could implement Virta to best serve our members and other stakeholders. So by background, we can flip to the next slide here. By background, I'm an internist and hospitalist. So I worked for about 18 years as a hospitalist. So I got to see, from a clinical perspective, the complications of diabetes that result in an inpatient stay, or the complications, both macrovascular, that lead to other chronic conditions related to diabetes. And of course, like many people on this call, we recognize the impact that diabetes is having on health outcomes and healthcare affordability. So as you already heard, Dean Health Plan is located in South Central Wisconsin and closely affiliated with SSM Health System. We serve a variety of communities and a variety of product lines. So going to the next slide, when we were looking at diabetes or diabetes partners, we were looking across our populations and looking at those disease states or conditions that were significantly driving health outcomes and costs. And when you look across our geographies and membership, really obesity and obesity-related conditions were driving a significant amount of the disease prevalence and affordability concerns. And so really, landing on diabetes and obesity as opportunities to address broadly across our membership, as we were seeing significant variability in not only the cost, but the outcomes associated with that cost. Also among our stakeholders, including employer groups and other purchasers, this was a significant priority as well. So as we were evaluating options for potential partners to address diabetes, we looked at several other competitors in this space and landed on Virta because of the wealth of evidence that there was existing to support it, the experience that prior partners had, and also how we thought that it would be complementary to the other treatment options that our health system and network partners offer. So we always wanted to make sure that we weren't tripping over ourselves and trying to make sure that we were providing something that was seen as complementary to what was already occurring in our physician and provider in our provider network. I think the next challenge we had was landing on a population to implement this with. So we had to consider, the financing, we had to consider the benefit design, we had to consider an engaged membership and population that would be most likely to engage and to show improvement. So when we looked across our opportunities, we decided to start with a small pilot with a very engaged large employer group. And they were, of course, very interested in improving their health outcomes, but addressing affordability issues associated with diabetes. They also had a significant percentage of their membership that had diabetes and was taking oral and branded drugs. So we elected to partner with them and position the Virta program really as an employer-sponsored benefit and leveraging as best we could the employer to engage their members and really supporting the employer too and helping their employees recognize that they were partnering with their health plan to provide this enhanced benefit to their employees. So, it's very early right now. So as you can see, our number of enrollees at 6 months is small, but growing, but similar to the slides that we've seen with the larger, earlier trials, we are seeing a significant decrease in not only the A1C, the clinical outcomes, also including weight change, but also seeing a number of patients who are significantly reducing the number of diabetes drugs that they're on. On the next slide. You can see here, and this is similar to the graph that was shown earlier, we're seeing a significant transformation as well as patients are getting into the green, right? So they had significantly poorly controlled diabetes, and an increasing number of them are getting better control and becoming controlled with that A1C under 6.5. And that percentage that were poorly controlled over 8 at 40% has gotten much lower as well. Here you can see, I think there are, a few things to highlight here are that, because of the deprescribing protocols that are in place that are sort of track the member as they're losing weight, like you'd seen on previous slides, we saw a significant number of patients that were having prescriptions that were deprescribed. As a provider, you're also seeing here drugs that were probably unsafe in combinations with other therapies too. So when you look at deprescribing sulfonylureas or TZDs. These are drugs that if they were being prescribed in combination with other hypoglycemics could have resulted in significant patient safety events. So again, that's another opportunity here to have more consistent care pathway applied across your membership. I think what we're seeing, though, which shouldn't be a surprise to other clinicians, is as the comorbid indications increase for some of these injectables, you will see them remain. You'll see your patients continuing to take them, especially if they continue to require them for weight loss or other indications such as cardiovascular disease. But again, significant decrease in the number of patients who are on insulin. The next slide. Again, this is where you're seeing, similar to the prior slides, significant reduction in the amount of insulin that our patients were taking, both starting at the baseline and then significant reduction at 180 days. Next slide. Again, this is what we were seeing even very early on. Significant weight loss has been occurring. So we have a significant portion of our membership losing even greater than 10% of weight. Next slide. And then, lastly, much like the story that Andy told, we have, our employer group has been, very pleased with the results, and the individual member testimonials are, very similar to the experience that Andy had. And a particular member recounted that, after being on Virta, she was a very early enrollee, had lost 65 pounds. She lowered her A1C by 2.4%, and also eliminated the use of Ozempic. And much like the slides that were shown earlier, has gotten significant improvement in her overall health as a result of this. So likely, improving a lot of those other health outcomes that were detailed in the earlier slides. And then lastly, as an employer or health plan, next slide, significant satisfaction and engagement remains from this. So by positioning this as a benefit, the employees have been very appreciative of having this program offered to them. And you'll hear these types of responses are very common, in that they're very appreciative that it was offered to them. They are very appreciative of not only the services and programming that's available, but really, recognizing, as Andy did, they're very appreciative of, who's putting this in front of them as a service. So either their payer, their employer, combination of both. I think there's a significant opportunity here, because patients and members, enrollees in the program are very appreciative of the service, and we have very early outcomes that support that. So I think that is all I had, and I appreciate your time. Thanks.
Wonderful. Thank you, Kevin. Really exciting early results from your members at Dean Health, and we look forward to future partnership and sharing the 1-year outcomes, hopefully not too long. So why don't we have our panelists come off of, or turn their cameras on. So I think that's just Amy. And we'll have the remaining time here on the webinar for some Q&A. So again, the audience is on mute, but you may type any questions you want into the Q&A box on your screen, and we will get to it. So I have a question here that I will direct to Dr. Amy Mckenzie around Virta Health's cardiovascular outcomes. And the question is, does Virta have any outcomes that are longer than 1 year for cardiovascular health improvement?
Yes, so I talked a lot about 1-year data today to kind of keep it all consistent across a number of the different markers, but we did run a 2-year trial, and we've published our 2-year data for a number of these things. And we actually extended that trial out to 5 years. And that data was shared at the American Diabetes Association this past summer at the conference. And we'll be writing that up for publication and submitting it to a journal for peer review. But we have 2-year cardiovascular data that's published and out in the literature. And generally, all of the findings were about the same. We didn't find anything that was concerning or risky or really any different from year one. Everyone still had improvements in the majority of their cardiovascular risk markers, diabetes potentially even being like the biggest cardiovascular risk factor of all. So we would be happy to share that paper. It's probably linked on our website as well, virtahealth.com/research, if you're interested in seeing more of the details. The other thing that we did over the longer period of time, over 2 years, was that we looked at carotid intima media thickness, so the thickness of the wall of the artery in your neck. And if that is getting worse over time, then that would be a concerning sign, and we didn't see that. Everything stayed about the same over those 2 years. So the ADA looked at our 1-year data, and they cited our 1-year data in their standards of care and their practice recommendations, this ADA meaning the American Diabetes Association. And they said in their consensus statement that they felt that the treatment that we provide doesn't pose any additional risk. And since we didn't find anything different at 2 years, it seems like we're doing pretty well.
Yeah, and I'll underline that. That's a really big deal to get that sort of level of validation from the experts around Virta Health's approach and our impact on cardiovascular health. I think early on in the Virta journey, there were legitimate questions about how a low carbohydrate diet could affect perhaps negatively cardiovascular health in the long term. But the fact that we're showing really positive impacts over as long as 5 years out is really significant. Okay, next question for Dr. Kevin Eichorn. This is with regards to your launch of Virta at Dean Health. Question around sort of targeting and selecting the ideal segments of your population to target for this intervention. Were there thoughts around starting with a particular line of business, fully insured, ASO, Medicare, and even were there other ways you thought about targeting specific segments of the population to drive the most value?
Yeah, no, we put a lot of thought into that, and as I mentioned earlier, I think where we landed was because of the desire to initiate this as a pilot. The consideration was really finding a highly engaged employer group on the self-insured side, so that we could position it as a additional benefit. It would make the implementation a little bit cleaner. That was the decision that we had. They also were a particular employer group that had a high prevalence of diabetes, so we're likely to see a significant engagement and improvement, and have a large percentage of their membership that would benefit from the program.
Great, thank you. And Kevin, we have a couple questions about older populations, Medicare. Does Dean Health deal with Medicare population? Would you consider this a good intervention for that segment?
Yeah, and I think I would have to defer to Amy to see what sort of data you have by age band. I think we were looking at where our employers or other stakeholders had the most financial risk, which is why we chose the lower age group. I think Amy, do you have evidence about our older populations receiving the same improvements as younger, or is that data still forthcoming?
We have looked at this. We've taken real world data from patients that we've treated in the real world, and we've looked at those with an age of 65 or higher, and across weight, A1C, and medication deprescription, and even retention in the treatment. We're seeing similar in the 65 plus group that we see to the rest of our book of business. So really no differences that we've come across to date.
Yeah, great. Yeah, and we are increasingly working with health plans on their Medicare Advantage lines of business too. So that's a growing area of focus for us here at Virta. Okay, Amy, question for you directly around the patient experience on the Virta treatment. I know we didn't go into this in great depth in the presentation. We were focused more on the research and the outcomes, but I think if we could spend maybe just a minute or two more talking about the patient experience, how does it work, maybe a little bit more about the role of health coaches, of Virta providers in deprescribing patients from their medications.
Sure. So first I'll say that Virta is a provider-led medical clinic. We focus on type 2 diabetes. So patients coming into our clinic have to come in with some historical labs so that we can ensure that our treatment is safe for them. And they meet with an intake clinician to learn a little bit more about their health history and to review all of their labs and qualify them for Virta. By and large, everyone who applies gets through. We have just a few medical exclusions. And then that we have a team of EAs who kind of help shepherd patients through that enrollment process to make sure that they have everything that they need before they go and meet with our intake clinician to get cleared for our clinic. And then once they are cleared, they are given access to our app. That's kind of this continuous remote care platform that I talked about earlier today. They get access to their care team, which includes a health coach and a licensed medical provider. And that care team is there to kind of guide them through on their journey. The health coach's role is generally to give them some nutrition guidance. Of course, the app provides a lot of educational information to help them get started. And the coach is really there to kind of work one-on-one with them and personalize everything to them, and really tailor everything about our nutrition guidance to their specific needs. So if they need to operate on a budget, or if they are a busy traveler and they eat a lot in airports, or if they have a big family to feed, our team is really there to kind of work with them to get their nutrition right. The other thing that the care team does is they look at the biomarkers that are coming in. So the patients get equipment, they get a starter kit, they get a body weight scale, they get a way to check their blood glucose and their blood ketones. And some patients get a blood pressure cuff, and they measure all this information, it logs into the app, and then it filters into our care team. And our care team is continuously reviewing this information to give the patient feedback and help guide them on their journey. So we're working with them on their nutrition recommendations to get everything right and help them reach their goals. The role of the provider then is to also follow those markers. And as we're watching blood glucose come down, because it comes down really rapidly in the beginning, the medical providers are deprescribing medications so that we can safely put them through this nutrition therapy and prevent them from having hypoglycemia. So the role of the provider is to keep them safe in that perspective. And then, of course, over time, a lot of the coaching turns into a lot of focus on behavior change and sustainability, and adjusting the nutrition recommendations to really find what's right for the person and what's going to be sustainable for them long term.
Great, thank you. And I'm sorry for those who still want to hear more about how the Virta treatment works. We can obviously spend more time on that in another setting, but I would just to summarize what Amy said is the Virta treatment is a combination of two things. One is a nutritional program based on carbohydrate restriction, and the second is a provider-led virtual clinic in which our care team is actively deprescribing patients from medications as they are making these nutritional changes. And related to that, one question we often get is like, well, just general skepticism from health plan leaders, from employer leaders who think that, people just don't stick with nutritional changes, like diets don't work, quote unquote. And they just have a lot of skepticism, and they're really surprised when they see our outcomes and the durability, the sustainability, and really the long-lasting effects, the reversal. And so I want to throw this question over to Andy, if you're still with us, around what would you say to health plan leaders and employer leaders who really doubt that patients can stick with a nutritional change like Virta? I hope you're still here. I don't see you, but let me know if you hear my question.
Well, I do hear your question, and it's an interesting thing to look at. But I've found that Virta is, instead of a diet, diet is considered, in my opinion, short term. This is a lifestyle change. This is changing how you live your life and finding a way to better how you feel. And once you feel, at least from my point of view, once I felt the lack of pain and the lack of inflammation, and once I saw the results, and I saw, I started feeling better, my psychology is better, I don't want to go back to where I was. And that's why I'm saying it's a lifestyle change. I mean, you have to change your attitude on how you do things. And, I think that's one of the things that my coach Laura has been really strong about is, let's work on long-term changes. Let's work on, how do you get past? Of course, you're going to get cravings for things that you shouldn't necessarily have, but how do you get past that? How do you find substitutes? How do you find things that make it work? And that's, once you start to find those things, you don't want to go back, at least from my point of view. And that's how you stay on it. And then you change the way you look at things. I mean, my cupboard in my house looks dramatically different than it did 6 months ago. And, that's the part of the lifestyle change. I mean, I don't consider myself dieting. I just consider myself doing things differently.
Great. Thank you, Andy. That's really, really well said. Another question we have here, I'll kick it back to Amy, about nutritional changes and accommodating different types of dietary restrictions. The person asked specifically about whether Virta works for people who are vegetarian or vegan, but I think related to that, we hear questions around different ethnic cuisines, access to food, social determinants of health, whether people live in a food desert. So maybe you could speak to that a little bit. Like, can Virta accommodate these different dietary restrictions?
Yeah, and the answer is yes, absolutely we can. So the nutrition therapy is generally focused around dietary carbohydrate restriction. So we focus on significantly lowering the amount of carbohydrates, so the breads and the pastas and the rice and the sugars in people's diets that they consume. And initially we aim for less than 30 grams per day, and we tailor that to their needs. So for vegetarians, they can generally get under that threshold. For vegans, we typically end up aiming a little bit higher, but they still see the clinical improvements. And I think we actually have someone on our blog who was vegan and kind of talked about his experience. So I think that this is definitely doable for all of them. It just takes a little bit of nuance and work with your coach to find the things that are going to work for you. And we can work with pretty much any food philosophy that someone has. And then when it comes to food access, that's a very real concern that we work with a lot of patients on. A lot of people live very far away from a grocery store, and they're limited by, what foods they can bring home and how often they can go. A lot of people are on a budget, so we help put together budget plans. I know I used to be a coach, and I used to help people shop for bags of frozen vegetables at Walmart that were $1 a bag. And it's working with your coach to figure out all of the different things that are going to work, but and finding other resources that are available in the area. And that's it's really able to be tailored to every person.
Perfect. Thank you, Amy. And I think maybe we have time for one more question, and then I'll end with a quick announcement before we wrap up. the questions around some of the behavioral health and mental health support that Virta might provide for patients who have challenges with emotional eating, binge eating, nighttime eating disorders, basically disordered relationships with food. How does Virta support those patients?
Sure. So we generally focus on behavior change to help people adopt a new lifestyle, like Andy was talking about. But if our clinical staff does observe patterns that are indicative of a more serious condition, then they often talk to the medical provider and help refer the patient to the appropriate care that they need.
Yeah, and I think there's, as you implied, there's sort of a gradation in terms of severity, and I think many people with type 2 diabetes have difficult relations with food, and those we handle internally, but for those that are more severe, those may get referred to experts when it makes sense. Okay, well, let's end there for Q&A. Shannon, if you don't mind, I just want to go to the next slide, and before we wrap up, just want to make a quick announcement that if you enjoyed today's session, highly encourage you to register for our upcoming virtual conference, which will take place on October 12th and 13th, Moonshots for Health. It will focus on the future of chronic disease care. So we're super excited about that. If you go to the next slide, I'll just kind of highlight a few of the speakers that we have coming. We have Chief Clinical Officer of Elevance, the Chief Medical Officer of CVS, leaders from Blue Shield of California, Banner Aetna, Willis Towers Watson. So, and this is just a sampling of some of the speakers we'll have at the event. Last year, we had over 6,000 attendees, so we're really expecting a wonderful event this year as well. So again, the website is moonshots.virtahealth.com. It is free to attend, and it's a virtual session that will take place over the course of October 12th and 13th. So we will wrap up there. And yeah, those are some of the themes that we'll be addressing during the conference. So with that, we can end today's session. I really want to extend my deepest gratitude to our patient, Andy Riddle, to Dr. Kevin Eichorn, and to Dr. Amy Mckenzie for your presentations. Thank you so much for all the work that went into your presentations. And to the audience, thank you for attending. Hope you got something out of today's session, and hope to see you soon.